Erectile dysfunction, or ED, is a common condition affecting men. It makes it difficult to get or maintain an erection firm enough for sexual activity. Thankfully, effective treatments are available. Two of the most well-known are Cialis and Viagra. Both medications help men achieve and sustain erections, but they work slightly differently and have unique characteristics. Cialis and Viagra belong to a class of drugs called PDE5 inhibitors. PDE5 is an enzyme that regulates blood flow in the penis. By inhibiting this enzyme, these medications allow blood vessels in the penis to relax and expand, increasing blood flow and facilitating an erection. Choosing between Cialis and Viagra can be confusing. This essay breaks down the differences, similarities, and potential side effects of each drug to help you make an informed decision in consultation with your doctor. Remember, this information is for educational purposes and should not be considered medical advice. It's important to consult with your healthcare provider to determine the best treatment option for your individual needs and medical history. They can assess your overall health, consider any underlying conditions, and advise you on the appropriate dosage and potential interactions with other medications you might be taking. Cialis, also known by its generic name Tadalafil, is a popular medication for treating erectile dysfunction. It works by relaxing the blood vessels in the penis, which allows more blood to flow into the area when a man is sexually aroused. This increased blood flow leads to an erection. One of the key features of Cialis is its long duration of action. Cialis can remain effective for up to 36 hours, earning it the nickname the weekend pill. This extended time frame allows for greater spontaneity compared to Viagra, which typically lasts for 4 to 6 hours. Cialis is taken orally, usually with a glass of water, and can be taken with or without food. However, it's important to note that consuming a high-fat meal before taking Cialis might delay the onset of action. Viagra, known generically as Sildenafil, is another effective medication for treating erectile dysfunction. Like Cialis, Viagra belongs to the PDE5 inhibitor class of drugs. It works by increasing blood flow to the penis, making it easier to achieve and maintain an erection when sexually aroused. Viagra is known for its relatively fast onset of action. It typically starts working within 30 to 60 minutes of taking the pill, allowing for more immediate results compared to Cialis, which can take up to 2 hours to reach its full effect. Viagra is also taken orally with water and can be taken with or without food. However, similar to Cialis, a high-fat meal can delay the onset of action. Section 4. Common ground. Similarities between Cialis and Viagra. While Cialis and Viagra have distinct characteristics, they also share some similarities. Both medications are effective in treating erectile dysfunction by increasing blood flow to the penis. They are both available by prescription only, meaning you will need to consult with a healthcare professional to determine if either medication is right for you. Both Cialis and Viagra come in various dosages, allowing your doctor to prescribe the most appropriate strength based on your individual needs and medical history. The typical starting dose for both medications is usually the middle option, but your doctor can adjust the dosage based on your response and tolerability. Both Cialis and Viagra are generally well tolerated. However, it is essential to be aware of the potential side effects and to consult with your doctor if you experience any adverse reactions. Section 5. Key differences: duration, onset, and side effects. One of the most significant differences between Cialis and Viagra is their duration of action. Cialis can be effective for up to 36 hours, allowing for greater spontaneity. In contrast, Viagra typically lasts for 4 to 6 hours. Another key difference is their onset time. Viagra tends to work faster, typically within 30 to 60 minutes, while Cialis can take up to 2 hours to reach its full effect. In terms of side effects, both medications can cause headaches, flushing, indigestion, muscle aches, and nasal congestion. However, some side effects seem to be more common with one drug than the other. For instance, back pain and muscle aches might be more common with Cialis, while Viagra might be more associated with visual disturbances. It's important to note that these side effects are generally mild and tend to subside on their own. However, if you experience any severe or persistent side effects, it's crucial to seek medical attention immediately. Section 6. Choosing the right option, factors to consider, and recommendations. Choosing between Cialis and Viagra depends on individual needs and preferences. If spontaneity and a longer duration of action are important, Cialis might be a better option. Its longer half-life allows for more flexibility in timing sexual activity. If a faster onset of action is desired, Viagra might be preferable. Its quicker onset time can be beneficial for men who prefer a more immediate effect. Ultimately, the best choice depends on individual factors and should be made in consultation with a healthcare professional. It's essential to discuss your medical history, any medications you're taking, and your expectations with your doctor. They can provide personalized recommendations and help you make an informed decision that aligns with your lifestyle and health needs.